seriously, we have like a minute or two to talk about BPH.
Okay.
Can you believe it? Then we're going to move on to stones. BPH, Dr.
How
Mertz.
quickly time goes by. Well, my only message to
So
people with
crazy.
BPH
Yes.
is,
And tell us what that means.
BPH is an enlarged prostate that causes lower urinary obstruction. It causes men to have difficulty urinating. And there's a lot of medicines. There are medicines out there that help people with symptoms of BPH. They improve their stream, they get the bladder emptying better, and they have a reduction in symptoms. But some people have been taking them for years, and along the way their prostate is enlarging and their bladder is failing. So, as a consequence, they're not doing as well as they think they are. So recognizing failure is important, because as people get older, and sometimes major events occur in people, such as heart attack, stroke, major surgery, disability, that would cause their bladder to fail, coincidental to the major event.
Right.
And then the bladder becomes a problem later on. Now, if there were earlier recognition in terms of that bladder failure, and earlier intervention with possibly minimally invasive procedures to open up the channel so people can urinate effectively, I think those people on the other side of that event wouldn't have to worry about their bladder. That problem would have been taken care of when they were in better health. Now, if they have that heart attack or stroke, they're a much higher risk patient.
Yeah, they are. And then we see the complications of that on many different levels. And it can be huge.
Well, you see them in the ICU. You see the people that now can't urinate with a major medical event.
Yeah.
And we see them, and people are desperate to have their normal bladder function again.
And really that's what all of this is about. And really, as you hear the different topics we're covering, that's what this is all about, is really what can any man do to put himself in the realm to have the best quality of life, whatever that is, working, home, whatever it is you want to, by paying attention.
That's right.
Detection.
Our business becomes very simple. We're in the business of keeping a person's bladder functioning their entire life.
Perfect.
And they expect that from us.
And they do.
But
you got it.
It is they have to follow recommendations, and part of it is having a urologist as an essential part of the team of making sure that they're still functioning adequately, and when they aren't, you got to bite the bullet and have something done.
Get it done.
Absolutely.
And then talk about this last, we're going to slide into this last topic. I'm telling you, this is so fascinating. And if you're just tuning in, if you're surfing by, as some of you say, this is In a Heartbeat. I'm Liz Aiken. We're talking about all things urological. My guest today is Dr. Tom Mertz, a urologist. We're going to talk about kidney stones. And let me just say right off the bat, I have not had one, so I don't know. They say it is the most excruciating pain short of childbirth, or some of that I do know, but I think that wasn't so bad, so I think kidney stones must be worse.
People describe, I've never had a kidney stone myself. I've seen
a baby, nor a baby.
Hundreds, well, the baby thing is, I can say I've had 3, but I've been one person disconnected from that event.
Exactly.
But it is a miserable experience for most patients. And there are 500,000 new stone events every year. It comprises probably 2-3% of the business in the emergency center at hospitals, and so there's an impact there. My point is, if you look at the demographics of stone disease, it's 3-to-1 male, and it takes people out of the game for a period of time.
Totally.
Where they're dealing with a stone, they can't go to work. A lot of times they're sole breadwinners for the family, and as a result, it puts a hardship on the family. So if they see a urologist early on, if they're given the opportunity to kind of fast-track treatment of the stone, that is
huge.
That would benefit them, getting them back into their normal life and back into the routine and being productive for their family. But the key ingredient here is not getting another stone.
You got it. And a lot of this, the great majority of it, is preventable
Absolutely.
by compliance.
Oh,
That's what I love that, was a commitment to change and compliance.
That's absolutely true. You can
Nothing
take a recurrent stone disease. A person who has a stone has about a 15% chance of having another stone within 12 months.
Person who has a stone has a 15?
15% within 1 year.
And if you've ever had one, you don't ever want another one.
Well, you don't want another one.
And we
exactly.
see them. We see
exactly.
recurrent stones.
Absolutely.
Terrible.
And but if you do the proper metabolic workup on these people with stone disease, and you make adjustments, and if the person's committed to the change,
Right.
whether it's diet or medication or a combination of both, you can reduce their stone risk
Right.
by 90%. So that person, if you take a person that had a stone who has a 15% chance of reoccurrence, if you can cut that down to 1.5%,
That's incredible.
I mean, that's a huge impact in terms of their life
All right,
and
now-
straightening out that risk.
You're right. And also now let's look at, in this time now of changing economic stuff, if you have an insurance program or something and you are now more responsible for some of the financial outlay, and you can avoid that just because, that's responsibility. All right, tell me that we have about a minute and a half. Can you stand? I wish we had 2 hours here. Tom,
This is fun
you're
for
the
me.
great- I know this is
Yeah,
so
I know.
fun. Finally.
Yeah, I know.
All right. What was I going to ask you? Oh, yeah. What's the culprit? What's the main culprit for stones, kidney stones?
Most often it's dietary. People find the easy route for food. One of the most common metabolic disturbances or urinary chemistry abnormalities we find is high urinary sodium. Well, sodium is one of those things that the body balances very, very well.
Yes.
So if your body has excess sodium, it gets rid of it. And so if your intake is mainly snack foods, lunch meat, soup, heat and serve items that you might put in the microwave,
Yeah,
they're
prepped.
loaded with sodium. There's simple changes to make. Anything that you prepare yourself, that you have control over, such as vegetables, meats, things like that.
Fresh.
Fresh, exactly.
Fresh.
And would be often solves a problem with the sodium consumption. Of course, you have to look at the snack foods. The snack foods
Yeah.
are huge, and they're hard to put down.
Yeah, that's true. Chocolate. I'm sure there's some good stuff about chocolate, but
Well, there's chocolate has its own. That's in the oxalate, and chocolate, cocoa,
Oh,
things like that,
antioxidant.
pepper, tea.
right,
things.
that's right.
But we can identify those things, and if a person moderates their consumption, it can make an enormous
Big
difference in their urinary chemistry.
Well, in listening to you, it seems that it's that I love that phrase from you, commitment to change and compliance, that really can be a panacea for many ills of the body,
Absolutely.
just by being responsible.
You take the male metabolic syndrome.
Right?
Do you want to be that way?
No.
Go
Change
ahead.
it.
Go on as you are.
Oh, yeah, the old dog
Yeah,
on the couch.
That's right.
Dr. Tom Mertz.
Oh.
Got to come back, man.
Okay, Liz.
It was great. Thank you so much.
Oh, you're welcome. It's
All
a
right.
pleasure being here.
Thank you.
Yeah.
You see all the information and how valuable this is, all right? Commitment to change and compliance. You know what Dr. Tom Mertz thinks. What do you think?